Hi everyone, welcome to Unit 4, the Skeletal System screencast. In this screencast, we'll be covering 7.1 and 2, the very first 4 objectives of your guided notes packet. We'll talk about what an orthopedic doctor studies, take a look at the jobs that the skeletal system have in the body, list the 4 major types of bones plus more and give examples of where they're found in the body, and identify the things that we can see, the macroscopic anatomical features of long bone. In the next screencast, we'll take a look at the microscopic anatomical features of long bone and explain the role of bone salts in the hardening process. Today we had a chance to have a guest speaker. Dr. Moen came in to talk to the class about her role in diagnosing and treating musculoskeletal disorders. These are disorders of the bones, joints, ligaments, which are bone-to-bone connections, tendons, which are bone-to-muscle connections, muscles and nerves, and how they all interplay with each other. Ortho refers to straight, and pedics refers to children. So orthopedic doctors at one point in time only cared for crippled children and those musculoskeletal disorders that developed in those children. The skeleton is made of 206 bones in adults, and there's more in children. They fuse together as you get older. And all bones start out with a cartilage model. So a cartilage model refers to bone that has not ossified yet. So I'll be using that word a lot, ossification. And that means the depositing and the hardening of bone through the deposits of inorganic materials like calcium. Ossification that's full happens when you're age 25, and your skeleton makes up about 20% of your total weight. Your skeletal system takes on 5 major roles. One of them is actual support. Remember that your skeletal system covers your very, very soft, very important organs like your brain, so that's encased in your cranium, your lungs and your heart, which are encased in your thoracic cage, and your spinal cord, which is encased in your vertebral column. Your skeleton is also the attachment point for muscles, and muscles are the ones that actually contract and move, but they must move against something, so your skeleton actually acts as a system of lever. These places where the skeleton, or rather bones, articulate with each other or touch each other are called joints. Bone is an organ. It's made out of different tissues that act together to fulfill a certain job in your body. And as an organ, it is responsible for storing inorganic materials like calcium and phosphorus, as well as fats. So it's a place for energy storage. And it's also responsible as an organ for having stem cells that later differentiate into blood cells. Bone is the actual place where blood comes from. This formation of blood is called hematopoiesis, and it takes place specifically in the red marrow of your bone. There's also a yellow marrow, which you may not be familiar with, but we'll talk about that a little later in long bones. Bones are also responsible for regulating calcium in your body. Calcium can either leach out of bones, for example, to help out with muscle contractions. Excess calcium can also be deposited into bones. And again, that means that bone is acting as a storage site for these inorganic materials. This is regulated by 2 glands, the thyroid and the parathyroid. Your skeleton is made out of 2 subskeleton regions. The very first one is the axial skeleton. These are about 80 of the 206 bones in your body, including your hyoid, and they're all upper body bones. The 3 subdivisions of your axial skeleton include your skull, your thoracic cage, and your vertebral column. The second skeleton is the appendicular skeleton. These include your arms and legs and the attachment places for those appendages. So here we're taking a look at the pelvic girdle and the shoulder girdle. This is a really great close-up of what these girdles look like. So you can see where the humerus, or the upper arm bone, articulates with several bones here, including the clavicle and the scapula, as well as the pelvic girdle. So you would have your femur attached here, articulating here. The hyoid bone is a special bone in your body that has no articulation. It doesn't meet with any other bone. It is attached to your tongue, so that's referred to as lingual attachment. It has a U shape, and it's superior to the larynx. Bones can also be classified by their shape. The four major shapes, these are not the only shapes, but the major shapes include long bones, short bones, flat bones, and irregular bones. So what I'm going to do here is if we take a look at this diagram a little bit better, you'll see that long bones are located really in the appendages. We're referring to the long bones of the upper arm, like the humerus, the radius and the ulna, the femur, the tibia, and the fibula. Short bones have cube-like structures, and these mainly refer to bones of the wrist and the ankles, so the carpals and tarsals. Flat bones are thin and usually curved, and these would be found in the thoracic cage, so your sternum looks a little bit like a tie, your ribs, which are long and flat, and your skull bones, which are flat and also curved. Lastly, we have irregular bones that make up the bulk of your spinal column, your vertebral column. And these are neither long, short, nor flat. Two more types of bones include the sesamoid bones and the wormian bones. And these aren't major types of bones, but the patella, which is your kneecap, is referred to as a sesamoid bone because it has almost like a sesame seed type of shape. Sesamoid bones develop within a tendon. Wormian bones are the bones that lie between major skull bones, right where the sutures occur. Sutures are the places where those bones fuse together at one point in time. So let's take a look at the macroanatomy of bone, the things that we can see with our naked eyes. The very first thing you can see when you're looking at bone is the periosteum. This is that tough fibrous membrane that covers the outside of the bone. So this is what you see when you haven't actually taken a look inside the bone. There are two main types of bone based on the role they take in the actual organ. The first one is spongy bone. Spongy bone is also known as cancellous. This type of bone has almost a honeycomb-like look, and it's a place where you store marrow, like yellow marrow, the fatty marrow that fills the inside of long bones, and also red marrow, which is found here at the very, very end of long bones, not in the shaft, but in the epiphyses. Compact bone refers to the outer dense bone that covers the spongy bone and offers a layer of protection. In flat bones, based on the shape we can classify flat bones, you actually have a sandwich-like effect of compact bone outside and then spongy bone inside. So the honeycomb-like inside the actual flat bone. The tissue that is associated with making stem cells is found in spongy bone. So this is the hematopoietic tissue, the red marrow that is found in the ends of long bones and also inside the flat bones. Long bones are defined by very distinct regions. So if we take a look at the humerus and we zoom in, we see that it's made out of basically two bulbous ends and a long shaft. The shaft of a long bone is called the diaphysis. The ends of a long bone, where I said the red bone marrow is being made, they're called the epiphyses. The place where the diaphysis meets the epiphysis is called the metaphysis. At this point, you can stop the screencast so you can find your guided notes packet and either review the words for the structures, the macroanatomy of a long bone, or you could take a few minutes to draw the long bone itself and label all the structures. When we take a look at a long bone, the very first thing that we see without cutting into it is the periosteum. We defined the periosteum earlier as a very, very dense sheath, almost fibrous in a way, that covers the entire bone. But as we go in, we can see that the long bone is made out of many different layers and many different parts. We define the diaphysis as the long shaft that makes up the middle of the long bone, and the epiphyses, both proximal and distal, which refer to how close it is to the trunk of the body. Proximal meaning closer to the trunk of the body, and distal referring to farther away from the trunk. Here you would find the sesamoid bone patella, so this is where your knee would be. We mentioned that the epiphyses are the ends of the bones. Bone growth in the long direction occurs in an area called the epiphyseal plates. So this is a region right here where bone grows outward and upward, so the long ways. Bone can also grow in girth in this way, and that occurs in the shaft, the diaphysis of the long bone. Let's take a look at where the spongy and the compact bone are located. Remember again that the periosteum covers all of the bone, so that's the very first thing you see when somebody hands you a bone. The spongy bone is located, like I mentioned, in the epiphyses of a long bone, and this is the place where stem cells differentiate to make new blood. The type of marrow that you'll find in this area is referred to as red bone marrow. Spongy bone goes all the way into the middle cavity of long bones, which is not empty. Everyone thinks it's empty, but it's not. That middle cavity is called the medullary cavity. Instead of red bone marrow, what you'll find there is yellow marrow, which is fat. So this is the energy storage that I was talking about earlier. Within this fat, you will find blood vessels running through, so not only arteries but veins. And this entire area is surrounded by a layer of very dense compact bone. So you can see the compact bone all here, all around the medullary cavity, and also surrounding the outside of the epiphyses. The last feature that I want to draw your attention to is the endosteum. The endosteum is a layer that lines the inner medullary cavity, and it has a similar function to the periosteum. Remember, the periosteum is the outside, and the periosteum, I want to also say, is a place where you find the muscles attaching. This is the actual sheath that the muscles will attach to. So in review, the epiphyses are mainly made of spongy bone. They're the ends, and they're surrounded by a thin layer of compact bone, and the periosteum, which is that tough sheath. The diaphysis is the shaft of the long bone, the middle part, and it has a central cavity, a medullary cavity, that's filled with fatty yellow marrow. It's also surrounded by compact bone. The epiphyseal line is a place where cartilage grows, and that's basically the cartilage model that I was talking about earlier, between the diaphysis and the epiphyses, where growth occurs in the long direction. Here's an excellent picture of where the epiphyseal plates are and two bones articulating with each other as well. You can tell that this is the femur and this is the tibia. You can take a look right here, the fibula hanging out. And in these particular pictures, you're going to see that cartilage doesn't show up, so you'll notice some empty gaps in here. And I'm going to fill in pink where cartilage is naturally found. Cartilage is found here in the epiphyseal plates, in the epiphyseal line, I mean. And cartilage is also found here at the end of the bones. This is the one feature I didn't talk about in the last picture. Articular cartilage surrounds the ends of the epiphyses and acts almost like a barrier or a shock absorber, so that bones don't rub against each other. Remember, this is all living tissue, and bones that rub against each other will cause a lot of pain to that particular person. In this bottom picture, it's a really good place to see where bone is growing in the lengthwise direction, the epiphyseal plate, the opening, the medullary cavity where fat is stored, and remember, fat is referred to here as yellow marrow, as well as noticing the place where red bone marrow is found, the place where stem cells differentiate into red blood cells. To continue with the vocabulary, remember the periosteum covers the entire bone, so it would be found down right here, the outside of the diaphysis. It's a place where you also find the periosteum also provides nutrition for the bone, so this is a place where you're going to find blood and lymph vessels as well as nerves. This is a place where osteoblasts, which are cells that form bone, and osteoclasts, which destroy bones, are found. And the periosteum also acts as the place where you'll find muscle attachment. So here I'm drawing a muscle right here, and that tendon is going to be attached to the periosteum. So it serves as the insertion point for tendons and ligaments. The medullary cavity, like we mentioned, again, is found in the middle of the diaphysis. It's full of yellow marrow, and that's fat tissue, not associated with making or the creation of red blood cells. The endosteum is the inner lining of that medullary cavity, so it lines all that inside. And there's also a layer of bone-forming cells, osteoblasts, and bone-destroying cells, osteoclasts, because the medullary cavity actually has to, you actually have to dig it out of that bone. Articular cartilage, like I mentioned again, is a pad of cartilage at the end of the epiphyses of the bones, the rounded ends, so that you can find some shock-absorbing protection against other bones. Now that we've covered all the macroanatomical terms of long bones, we will cover the microanatomy in the next screencast.